Yeah, hello and welcome back to our next case of the month. Here, a case which we've solved completely with just classic prosthodontics, no orthodontics or anything else. So, again, as always, a great thanks to the dental technicians and the Hagemoser in that case, which has done, as I think, a tremendous job again. Patient was extremely happy, and how happy I will show you at the end. Initial situation you can see here already. A patient not used to smile at all. The smile looks unnatural, and the patient is not really confident to smile. And it's always easy to see the patients hold their hands in front of their mouth or a distorted smile as here. So something clearly wrong. If we have a look at the situation, we can see a very deep bite. Additional tongue habit leading possibly to a gap between the canines and the first premolars. And if we have a look from the occlusal plane as well, something you can maybe see in a lot of these cases which show any functional or dysfunctional habits is the sand glass shape in the upper jaw. So that means the premolars are slightly more palatal than the molars and the canine. Very similar to the lower jaw gap between the canines and the first premolars. And patient wanted to have a result as soon as possible. So no orthodontics, no composite build-ups, no testing phase. So we decided why not take the risk. Initial impressions, digital photographs, and get a digital wax up done and a long-term temporary, and then immediately start. You can see here the situation of the final preparation in the upper jaw and lower jaw. We've done it in a staged approach. First upper jaw preparation temporary, and then lower jaw preparation temporary, but all was done in one session, and we needed something around 4 hours. It's a debatable case, no doubt about that. We could have done just with whitening, orthodontics, and so on. But as I said, firstly, we need to address the functional aspect of the case, and we need to address the time aspects as well. And if the patient is advised about the implications that we just remove a lot of enamel, then sometimes I think why not do it? Because the patient, I think, was 35 or 34. This work has around 90% chance to last between 18 and 20 years with maybe 1 or 2 fractures, which we can repair very easily. And then the patient will be around 55, 60, and then we do just one more work. And then he probably goes to his grave with fantastic teeth and has fantastic life quality in between, and has the confidence of a great smile. So in my case, and judging from the patient's reaction, it was definitely worth it, hurting the patient that badly. Then taking the bite just very classically, with sun tray and a rebite. Then, like I said, staged approach, upper jaw preparation temporary. In the same session, lower jaw preparation temporary. Getting the information across to the technician. And then final work. So this work was done within 2 weeks or 2.5 weeks, and you can see if you remember the difference in the smile from the initial smile. Now the patient is completely happy to smile. He has great teeth. Yes, a few things we could have done better. For example, slightly longer upper right canine, slightly longer right lateral incisor, and so on. But for the initial work, for just immediately getting it fixed and done, it's not bad. In the upper jaw, from canine to first premolar, we've placed some bridges. In the lower jaw, we just close them with a slightly bigger premolar. And of course, we then in the end placed the Michigan eye cut just to protect the work. And in the initial treatment plan was in the lower jaw from canine to canine to just place composite fillings. But I told the patient, look, I want to have the job done properly. We place veneers, and I'll do them for free. I'll just charge you for the fillings. And the patient was so happy that he actually, in the end, paid for the veneers, although I didn't ask him to do it. So I think sometimes the happiness of a patient having really nice teeth after such a long time of suffering is an aspect we really underestimate as dentists. So thank you very much for watching this small case, and I wish you all a lovely evening, morning, weekend, or week, wherever you are. Thank you very much, and yeah, hear you soon.